What causes hormonal imbalances? Hormonal imbalances can be caused by various factors, including age, stress, unhealthy diet, sedentary lifestyle, medical conditions, and certain medications. Hormonal imbalances can also result from dysfunction in the endocrine glands responsible for producing hormones. Common endocrine gland disorders that can cause hormonal imbalances are thyroid, adrenal, and pituitary gland disorders. How can I tell if I have a hormonal imbalance? Various symptoms can indicate a hormonal imbalance, such as changes in menstrual cycles, mood swings, fatigue, weight gain or loss, skin changes, and sleep disruptions. In some cases, there may also be symptoms such as decreased libido, hair loss, and infertility. See a doctor for a proper diagnosis if you are experiencing any of these symptoms. What are the symptoms of hormonal imbalances? Hormonal imbalances can have a variety of symptoms, all depending on which hormone is affected. Some common symptoms include irregular menstrual cycles, hot flashes, night sweats, fatigue, depression, anxiety, acne, and weight gain or loss. Hormone disruption can often trigger serious health concerns, including increased risk of developing osteoporosis, infertility, and thyroid disorders. What treatments are available for hormonal imbalances? The treatment for hormonal imbalances depends on the underlying cause of the imbalance. Hormonal imbalances can be treated with medications, hormone replacement therapy, lifestyle changes, and in some cases, surgery. A doctor can determine the best treatment option based on the individual's symptoms and the underlying cause of the hormonal imbalance. Can hormonal imbalances be prevented? In some cases, hormonal imbalances can be prevented through lifestyle changes such as maintaining a healthy diet, exercising regularly, managing stress levels, and avoiding smoking and excessive alcohol consumption. Additionally, getting regular checkups and managing underlying medical conditions can help prevent hormonal imbalances. Can hormonal imbalances cause fertility issues? Hormonal imbalances can affect fertility in both men and women. Hormonal imbalances such as anovulation, absence of ovulation, irregular menstrual cycles, and low sperm count can cause infertility. Treatment for hormonal imbalances can help improve fertility and increase the chances of conception. How do hormonal imbalances affect weight? Hormonal imbalances can affect weight by altering the metabolism and disrupting the balance of hormones that regulate hunger and satiety. For example, an underactive thyroid gland can cause weight gain, while an overactive thyroid gland can lead to weight loss. Hormonal imbalances can sometimes lead to water retention, which can cause drastic changes in weight. Are there any natural remedies for hormonal imbalances? Various natural remedies can help alleviate the symptoms of hormonal imbalances, such as herbal supplements, acupuncture, and aromatherapy. A healthy diet and regular exercise can also help regulate hormones and prevent hormonal imbalances. However, it is important to consult a doctor before trying any natural remedies to ensure they are safe and appropriate for your situation. Can hormonal imbalances cause mood swings? Hormonal imbalances can cause mood swings by altering the levels of hormones that regulate mood, such as estrogen and testosterone. Symptoms of mood swings can range from mild irritability to severe depression and anxiety. Hormonal imbalances can also lead to sleep disturbances, further exacerbating mood swings. How can I manage the symptoms of hormonal imbalances? The best way to manage the symptoms of hormonal imbalances is by treating the underlying cause. This may involve taking medications or undergoing hormone replacement therapy. In addition, lifestyle changes such as eating a healthy diet, exercising regularly, managing stress levels, and getting enough sleep can help alleviate the symptoms of hormonal imbalances. In some cases, natural remedies such as herbal supplements and acupuncture may also be helpful. Consult a doctor to determine the best approach for managing the symptoms of your particular hormonal imbalance. How long does it take to correct a hormonal imbalance? The length of time it takes to correct a hormonal imbalance depends on its underlying cause and severity. Some hormonal imbalances can be corrected with a single course of treatment, while others may require ongoing management. In some cases, it may take several months to see a significant improvement, while in others, it may take longer. The key is to work closely with a doctor to develop an appropriate treatment plan and monitor progress. Can hormonal imbalances lead to serious health conditions? In some cases, hormonal imbalances can lead to serious health conditions, such as osteoporosis, infertility, and thyroid disorders. In severe cases, hormonal imbalances can also increase the risk of heart disease, diabetes, and certain types of cancer. It is important to consult a primary care doctor if you suspect you have a hormonal imbalance and to receive prompt treatment to reduce the risk of developing serious health conditions. How does stress affect hormonal imbalances? Stress can have a significant impact on hormonal imbalances. Stressful situations lead to the production of hormones like cortisol, which can throw off the delicate balance between hormones in your body. This can lead to various symptoms, including weight gain, mood swings, and insomnia. In addition, chronic stress can weaken the immune system and increase the risk of developing certain diseases. How do diet and exercise impact hormonal imbalances? Diet and exercise can play a significant role in regulating hormone levels. Eating a diet rich in whole, unprocessed foods and low in added sugars can help maintain hormonal balance, as can regular exercise. Regular exercise can also help reduce stress and improve mood, which can, in turn, help regulate hormone levels. Whereas, an unbalanced diet comprised of processed food items lacking in dietary fiber can be detrimental to hormonal balance and might even give rise to serious health conditions. What role do hormones play in menopause and andropause? Hormones play a crucial role in menopause and andropause, which are the natural transitions that occur in the body as a woman and man enter their later years, respectively. During menopause, the production of estrogen and progesterone decreases, leading to a variety of symptoms such as hot flashes, mood swings, and sleep disturbances. Similarly, testosterone levels decline during andropause, leading to a decrease in muscle mass, bone density, and sexual function. Hormonal replacement therapy may be used to manage these symptoms. Can hormonal imbalances cause skin problems? Hormonal imbalances can cause a variety of skin problems, including acne, hirsutism, excessive hair growth, and melasma, dark patches on the skin. These skin problems are often caused by an excess or deficiency of hormones, such as androgens, male hormones, or estrogens. How does hormonal imbalance impact sleep? Hormonal imbalances can disrupt the normal sleep-wake cycle, leading to insomnia, sleep apnea, and other sleep disorders. This can be due to imbalances in hormones such as cortisol and melatonin, which regulate sleep and wakefulness. In some cases, hormone replacement therapy or other treatments may be used to improve sleep. Are there any side effects from hormonal imbalance treatment? There can be side effects from hormonal imbalance treatment, such as nausea, headaches, and mood changes. However, these side effects are typically mild and temporary. Sometimes, the effects of a particular treatment may be managed by changing the dosage or switching to an alternative option. Can hormonal imbalances be caused by medication or medical conditions? Yes, hormonal imbalances can be caused by medication or medical conditions. For example, some medications, such as birth control pills, can disrupt hormonal balance. At the same time, conditions such as polycystic ovary syndrome, PCOS, and thyroid disorders can also lead to hormonal imbalances. How can I find a doctor who specializes in hormonal imbalances? You can find a doctor specializing in hormonal imbalances by contacting your primary care doctor for a referral, searching for a specialist online, or contacting a local hospital for recommendations. You can also seek a doctor who specializes in endocrinology, which studies hormones and their impact on the body. It is important to choose a doctor who is experienced and knowledgeable in treating hormonal imbalances to ensure the best possible care.